Okay, well, we're in the Clear Thinking Cube, and I'm very excited to welcome McArdle, the Shadow Minister for Health, into the Cube today. So, hi Mark,
hello,
thanks for coming for a chat.
My pleasure, my pleasure.
I've been fortunate enough to have a couple of VIP visitors and a lot of friends drop by, but we've got a serious topic to discuss. Quite obviously, I wouldn't be sitting here if I didn't care about youth mental health, and so I'm just wondering if you've had any personal experience with youth mental health, or what matters most to you about it.
Yes, I have had a personal background with youth mental health. I won't go into the details, but I certainly understand what families go through when a loved one is in the throes of mental health illness. I certainly endorse the principle that we must get into our community an awareness of youth mental health, remove the stigma associated with mental health, and get into place services to help young people get through those early stages and get back to their loving families.
Yeah, I think we had a mother in here on Tuesday whose son has schizophrenia, and one of the things she said was just that you really have to be aware as a parent of even minor changes in your child's behaviour and then immediately seek help. And one of the things she didn't do was sort of push through with her GP, no, I don't think this is normal, and ask for more help. So I think the services and things that we need to provide obviously need to be able to help people access the right kind of help.
That's exactly right, and our community is still quite concerned about the issue of mental health. They don't understand it, they're fearful of it. But I agree, GPs are a wonderful source of first point of contact. GPs are very busy, and if a parent is concerned about their child's behaviour, they must push the GP to undertake tests or to refer them to somebody else to deal with the issues. There's nothing worse, I think, than seeing a loved one fall apart, and when you're a parent, it's equally or even more so painful.
Yeah, I think I only became a parent 11 months ago, and I'm going to be second time around in February. But one of the things that concerns me most is that I'm not sure that most people or most parents are aware that 1 in 3 children will experience a mental health disorder before they turn 25.
I think that's exactly right, and I think you need to tackle the issue right at the early stages, because then what you don't get is a fully blown mental health condition that goes on for years and years. We don't want people in hospitals, we want people in the community. To do that right, let's put resources and manpower into our community to attack the front end of the problem, not the acute end.
Yeah, and I suppose one of the other statistics that we're concerned about is the fact that the GPs are the best point of contact for first-line treatment, but 40% of young people don't respond to first-line treatment. So we're trying to help the community to understand that we need a research centre for youth mental health that will sort of take over from the point where the GPs can no longer help young people and get involved with making specialist care available to young people with mental illness, so that we can reduce the time it takes to diagnose people with schizophrenia, which is between 5 and 10 years now. And you've made that point exactly, that by the time we get to that stage, we're already relying on other resources to help them, rather than being able to keep them with their families and within their support networks and on the drugs that will help to keep them as a valuable member of the community.
That's exactly right. We pour the health dollar into the hospital end. By the time people get to the hospital end, it's too late.
Yeah.
The early stages are well and truly past. They're an acute phase. Let's pour the dollars into as much as we can into the early stages, get people on courses, on drugs, on treatment. I can tell you this now, there's nothing more important than a person's family to help them through a difficult time. A mental health illness to the person themselves is compounded if their family is not with them or if their family can't be with them. The love of a family can never, ever, ever be underestimated.
Yeah, I couldn't agree more. So I suppose, this is the first time I've really got involved in something that requires a lot of government support in terms of getting it off the ground. And we're trying to write a business case next year that will help us convince the government to give us funds for the Youth Mental Health Centre, but what advice can you give me and the community in terms of what we need to do to create the uprising that will create enough pressure to get that money?
Well, I think issues such as what you're doing here today is an excellent example. The people or the public are still quite concerned about mental health. I'm quite happy to offer my support any way that I can to inform the public by Parliament and other areas as well about the issues regarding mental health. I think it's a matter of any good cause can start with one person and just keep knocking on doors. I'm meeting with Professor John Mendoza very soon, a well-renowned expert in the area of youth mental health. Now, he's a wonderful man who has some great ideas that he's going to inform me about schizophrenia, about youth suicide, and about mental health the week after next. And I was fortunate enough to share a stage with him about a month ago. And I've got to admit, being a Shadow Health spokesman, one of the great things you get to do is meet wonderful people. And he is a wonderful, caring human being. He has some wonderful ideas. So I would say keep doing what you're doing. We will pledge our support to ensure we do get the centre up and running and make certain people become aware of the issues of mental health, that young people get treated, and that everybody understands that mental health is an illness that can be treated, and people should not be scared of people with a mental illness.
I think you've made a good point there, because it is an illness and it still suffers from people not knowing about it. And even if you go back sort of to the lighter end, if you like, of the scale, so not the severe schizophrenia, but even depression, people there's some kind of misconception that people think, oh, somebody with depression, they should be able to get up and get on with things, and it's an illness and it needs more compassion and more understanding.
Yes, it does. And I think it's most important that people understand that depression is a very debilitating illness. It can rob you of your desire to get up in the morning. It can rob you of your desire to go to work. Some people go through such illnesses that, in fact, the biggest thing they do, the biggest achievement is to get out of bed. Yeah. And maybe that's the most important thing for them to do. Yeah. And then go in tiny steps along the way to full recovery. Yeah. We don't understand enough about mental illness. We don't understand how people feel when they're going through mental illness, and we need to be more compassionate about their concerns and desires.
I suppose that's one of the clear thinking messages, is that we're very concerned about research into mental illness. We're hoping that the Research Centre for Youth Mental Illness will help to reduce the diagnosis time, because we are using clinical research as a way to monitor patients from the point that they come in to when they are accurately diagnosed and beyond, so that we can help people in the long term. But I think another point that you touched on before, as well as the depression and the stuck mental illness, is suicide. We've run some statistics, and in Queensland 507 people commit suicide a year, which is just a horrific figure, and something that I think we can do a lot to prevent. 10% of young people try to attempt suicide, and that's just horrifying. It's
a shocking figure. And can I make this point as well? I think that one of the things we need to start thinking about is the reporting of suicide. Not how, but the fact of. Because we have programs that deal with road safety, about drug abuse, but no one's prepared to discuss the reasons for suicide. It's a silent section that's never touched. If we're going to be real about dealing with the issues of suicide, let's talk about why people suicide, not the how. If we understand how, we're going to start tackling those problems with more funds, more research, and more understanding.
I think that's one of the reasons why on our ClearThinking website we do have a lot of information about other places that you can access if you do know anyone that's suffering from depression or that you're worried about. The numbers for Lifeline and for Kids Helpline are all on there. But the majority of people, or the majority of that 10% of young people who attempt suicide, are suffering from a mental disorder at that stage. So that's really where we think that early intervention and the research associated with that can really help reduce the number of people.
Absolutely correct on the money. There would be nothing worse than being a parent whose teenage child suicide because